Hey, hello my fellow YouTubers. It's Thursday, April 23rd, 8:15 a.m. Denver time. Let's see what we're going on with the Nazi crowd. Chris Connell, Delaware Senator, each state needs 100,000 to 300,000 people for contact tracing teams. California Newsom wants to train 10,000 contact tracers. Washington State will implement a rapid response contact tracing team organization. Connecticut is considering a partnership with New York and New Jersey to launch a tri-state contact tracing program. Pence said the CDC would be deploying teams of 10 to 12 people to each state to assist the local efforts on a 12 to 18-month rotation. Recently, CDC Director Redfield suggested his agency would work with states to deploy many more people. Massachusetts has already hired more than 300. Maryland, Minnesota already have teams, but both states say they need hundreds more. Maryland estimates it will need to quadruple from 250 to 1,000. Mayor Bill de Blasio says thousands and thousands of contact tracers will be put to work. Oh, where am I at here? Wednesday, 35,000 State University of New York and City University of New York students will spearhead an army of tracers. ABC, this is an ABC News article from the 20th, and it's titled "States Race to Start Coronavirus Contact Tracing: A Monumental Task Ahead." Go read that article. There's more in there to mention other cities, but they group them in a paragraph. Yeah, they're learning from a Nazi book, the Event 201 book, the 22 Olympic Ceremony book, the Rothschilds papers, the shit they've been planning for somewhere around 50 years. It is gonna get so bad here. And like they started saying on that little thing I caught across a ticker a week ago, whenever the hell it was, we're gonna hire these unemployed people to do contact tracing. I mean, yeah, they're gonna have their neat little armbands, they're gonna have their badges, and they're gonna be more than happy to tell on you. They are going to be on a power trip with the police and military backup more than any meter maid you have ever pissed off. Until next time, we're fucked and see you later. Bye.
Let's get right to the announcement on what needs to happen to reopen the economy. KPIX 5's Andrea Borba is live in San Francisco with people eagerly listening to what the governor had to say. Andrea?
Well, Elizabeth, Governor Gavin Newsom says he needs an army of contact tracers to help isolate any new cases that pop up of COVID-19 and quarantine them to stop any more spread of the disease.
There is no light switch, and there is no date.
Those looking for a hard and fast date to end the statewide stay-at-home orders did not get that answer at today's briefing.
A couple of additional things. To reemphasize this concept of it's not a switch, it's a dimmer. That we are constantly looking at how quickly we move that dimmer, understanding where we are with our data.
What was laid out was one of Governor Gavin Newsom's 6 key points to loosening restrictions: contact tracing.
When someone tests positive for COVID-19, we want to be able to identify those who've been in close contact with that person. And for each of those persons that we are contact tracing, we want to be able to contact them first. We want to be able to check their symptoms, offer testing, and recommend isolation to start.
Governor Newsom emphasized that this would not be an entirely fresh project, that such programs are deployed on a local level already for HIV and tuberculosis.
You have trained professional workers in local health departments that do this every single day. The question that's asked of us now is to do it at a scale that we have not seen.
But that some state workers may be asked to receive additional online training to ramp up the contact tracing force to 10,000 workers, all in an effort to identify and isolate any additional outbreaks of COVID-19.
It also allows us to modify our stay-at-home order because we have more confidence that when somebody is infected or when somebody is exposed in our community, that they are going to join us in trying to limit the spread by staying home and isolating or quarantining.
Now, there was a tiny bit of loosening offered up at today's news conference with Governor Newsom. He was talking about the return of essential surgeries to hospitals. For quite some time now, hospitals have been reserved for COVID-19 patients. Now the governor says those hospitals can bring back some of those essential surgeries, those heart surgeries, those hip surgeries, things people need to live to make sure that more health outcomes don't pile up in the middle of this crisis. Live in San Francisco tonight, Andrea Borba, KPIX 5.
Hello, this is Dr. Paul Cottrell, and I'm going to be talking about Governor Cuomo and his news briefing today. It's Wednesday. Now, he showed the stats. Again, we have total hospitalizations starting to go down. We have total ICUs going down. We have total intubation going down. Again, I mentioned that doctors are reducing intubations because one, not as many people need them. Two, the non-hypoxia, the non-ARDS hypoxia paradigm is slowly being adopted, trying to find other ways for providing oxygen to the patient instead of forced air, because of Dr. Kyle Seidel, paradigm. I'll call it the Dr. Seidel paradigm, but it's the non-ARDS paradigm here. So that's all good news. We also have deaths. The last 3 days, we've had deaths go down to about the high 400s, like 470 or so. So we're, instead of this, the high 700s or 800 per day, now we're at 470 on average or so. So that's good news that number's going down. That makes sense because all those high numbers of deaths were, somewhat correlated to the surge that I was talking about in March, late March 26th, around March 26th, 25th, 26th, 27th was when we had the surge in New York City, in the state of New York. So we are getting better, and so all the metrics are showing that we are now past the peak. That doesn't mean that we're out of the woods yet, so we still have to be careful. Now, this video is more dealing with the issues about testing. Now, they want to do further testing, maybe antibody testing. He's not really sure on what exactly the testing is, but he wants to institute a much larger testing program, a much larger contact tracing program in the state of New York. It would be orchestrated in the tri-state area, so Connecticut, New Jersey, and New York, and it would be further developed by Bloomberg. All right. Bloomberg is offering services to be able to trace because they have technology through Bloomberg the company, Bloomberg LP, that whereby they would be able to do some tracing, kind of similar to what Johns Hopkins is doing, but for the tri-state area, and maybe implemented across the nation. But this brings up a lot of different issues. One, if you're working in an area, let's say you get out of shelter in place and you go back to work, and someone in your office contracts COVID-19, then everyone that's in contact with that particular in contact with that particular person would have to go into quarantine. All right, they would test positive. The system would say, "Oh, who were you around the last, let's say, 14 days?" They would put all those people in the Bloomberg database, and then all those people would be analyzed and find out who did you contact, and all those people would be put in the database. So you have not only primary, but you have a secondary potential contact trace. All right? They can't really do it right now because there's too many people. But as we get out of shelter in place, they're going to start implementing the contact tracing, and then they're going to start putting that in that Bloomberg database. All right. Once they do that, they're going to force the individuals that at least at the primary contact, the first degree contact, would have to be sheltered in place. Maybe the secondary. It's not clear, but definitely the primary. So in this case, your coworker gets sick. If you're in anyone on your floor or anyone in your work that is associated with that person would have to be sheltered in place, probably for 14 days. All right? And then they would continue to test you. If you test positive, then you would stay in quarantine for the duration of the illness until you no longer are, quote, testing positive, or at least you have the antibody. All right? So he's not being clear on if it is a RT-PCR test or an antibody test or a combination. So that's left up in the air. But I find it very odd that Bloomberg is now associated with data banking the ones that are going to be associated with the people that start to get sick. That he is building the database for the contact tracing. All right. It also brings up the problem whereby if you do have an antibody and you're not sick anymore, you go to work. All right. What happens when you don't have the antibody and you haven't been sick and you're not in quarantine because you're not associated with anyone that is sick? How do you go back to work? Do you go back to work as is, or do you have to have an antibody to go back to work? I think what will happen is that people that aren't sick, that do not have an antibody, will be going back to work. But once we get out of shelter in place and people start to get reinfected and they start to build up this database, the next wave of policies, at least in the tri-state area, New York, Connecticut, and New Jersey, maybe, at a town near you, is you'll have to have the antibody. And that will be in conjunction with either something that's developed by Distributive Bios, who's working on antibody vaccines, or they are going to institute the messenger RNA platform, from Moderna, which I think is going to happen. I think Fauci and the gang is pushing the Moderna platform. So we gotta be careful on how they're slowly rolling out the forced vaccine program. This right here is the beginnings of it. Get out of shelter in place. People that get sick are now Gestapo'd. They have a Gestapo now, run by Bloomberg, to track you. Not only the ones that are sick, but the ones that are in contact with the ones that are sick. All right? As they work out the kinks for that, they'll be able to now understand the dynamics of the reinfection wave. Either the dynamics of the reinfection of the primary wave, which I said the reinfection could be primary 1.1, 1.2, where you have mini waves in between the primary and secondary wave. You might have little mini waves. Or we may have a larger wave, we may not have many waves, and just have a larger wave that's happening in October. All right, but I suspect that we're going to have a few infectional waves in New York once we get out of shelter in place, which I'll call them primary 0.1, primary 0.2, before we get the big secondary infection wave in October. That's what I suspect is going to happen. But during these mini waves, Bloomberg is going to be data banking you. If you get sick, you're data banked. If you're in contact with someone that was sick, you're going to be data banked. All right? Who's watching the watcher? How long does it stay in the database? What is your what sort of privacy is guaranteed in terms of personal information? How do we know it doesn't get hacked? There's a lot of civil liberties here that we need to start talking about. All right? But this is the next step for the rollout of forced vaccines, either an antibody vaccine or this messenger RNA vaccine. So stay tuned. This is happening, and this is happening to a county near you. Thank you for listening, and have a nice day.
Like a diamond in the sky, you know. Look at the lobby, I get the party jumping, lovers are falling, something, someone lit with the 40 grip, rocking, and we gon' roll from the floor to the top. No, stop until it's sunny, pass the Dasani bottle, fill it with the cardio, fill him with the cardio, up like a bald eagle. I'm on. Oh, I'm on. Like a diamond in the sky. You know more. I've been looking for somebody just like you.